Hello friends! If you're a caregiver of a home or bedbound client or loved one, then this channel is for you. My name is Slava Kreynovich. I'm a nurse practitioner and I do house calls. Here I'm creating a community for caregivers where you can get your questions answered, share your tips and ideas of how to take care of home or bedbound client or loved one, as well as address your personal, emotional and physical needs as a caregiver. Today, we are talking about a serious threat, pneumonia. I once took care of a patient called Margaret, a 92-year-old, sharp as a whip, but stuck in bed because of hip fracture. Her daughter was doing everything right for her, but no one had taught her what I'm about to share with you today. When Margaret started coughing, everyone thought it's just a cold. It turned out to be pneumonia. Thankfully, with the very early treatment, Margaret recovered fully. So I decided that it's very important to share this information and steps to take to prevent pneumonia, as knowledge saves lives. Pneumonia is an infection in the lungs. It can be caused by bacteria, by virus, as well as by food or liquid that's not going down the right pipe. That's when we call it aspiration pneumonia. So why are immobile people more likely to develop pneumonia? Because when somebody is not moving much, it's harder for the lungs to expand and contract properly to clear out the mucus. And the fluid that's stagnant in one part of the lungs becomes a very good breeding area for the bacteria. Some people have trouble swallowing, which increases even further the risk of food and saliva getting into the lungs. And don't forget, weaker immune system and chronic illnesses make it easier for the infection to hold on. So how do you know to suspect pneumonia and what to do and who to call? The symptoms that you need to watch for are either new or worsening cough, fever or chills, rapid breathing, or change in mucus color. If you find at least two of these symptoms, you need to call the medical provider for evaluation. But here is the good news. In the majority of the cases, we can lower the risk of developing pneumonia in our loved ones. And I prepared 7 practical steps how to do it. Number 1, encourage deep breathing. Especially it's important for clients or loved ones that are bedbound. Remind them to take a few deep breaths every hour. The phrase that you can use to make it simple and easy to do. Smell the flower, blow the candle. It works. Use an incentive spirometer. This simple device helps to expand the lungs. If your client has been hospitalized, it's a very likely chance that he or she will have it at home available. But if not, they're sold online, in the medical supply stores, or at the pharmacy. Call your medical provider and ask for directions and recommendations how to use it. Step number 3 is repositioning every 2 hours while awake. It also will help not just with the lung function, but prevent pressure ulcers as well. And step number 4 is the most important one in the prevention of aspiration pneumonia. You want to make sure that when you're feeding your client or loved one, they're sitting up about 75 to 90 degrees, either here or here while eating, and staying in this 90-degree sitting up position anywhere between 30 and 60 minutes after eating the meal to make sure the food got down and preventing it from getting into their lungs. Step number 5 is staying on top of dental hygiene. Bacteria tends to stick to the teeth or dentures, so make sure to offer to brush the teeth twice a day and dentures as well. You want to watch for swallowing issues. If you notice that your client or loved one starts coughing or choking when they're eating or drinking, there might be a problem with swallowing that will again increase the risk of food or liquid getting into the lungs. So you want to call the medical provider, notify about this change, and ask for swallowing evaluation. And very likely, if what we call dysphagia developed, then you will be provided with means and tools how to prevent the aspiration. There are such products as Stick-It to thicken the fluid, so patient has time to swallow because the fluid will not be running so quickly. Or start eating pureed food versus chopped food because it's just easier to swallow. And as a final step, I would encourage you to check with medical provider if your client or loved one got vaccinated against pneumonia. There are 3 different vaccines against pneumonia, and you want to check which one is right for your client, your loved one, maybe even for yourself, and make sure that you get vaccinated. Caring for someone who's immobile takes patience, love, and whole a lot of quiet strength. And the more you know, the better care you can provide without burning out. If you found this video helpful, please like the video, consider to subscribe, and share with someone who may benefit, as knowledge saves lives. As always, wishing you a good health, and remember, joyful heart is the best medicine.